Mes chers collègues,
My dear colleagues, 2015 has been, in many respects, a terrible year for us in France. It was a year marked by terrorist attacks, by deaths, and it's been a year during which our profession has been called upon to act much more than in previous years. We're now living in very difficult times. And I think we haven't really realized just what efforts our politicians are making on a day-to-day basis in order to ensure that our health service remains capable of facing up to all these challenges in a prompt fashion. We have to face epidemics and terrorist attacks to an ever greater degree. And our health system has, in fact, responded to all these challenges. And we must also acknowledge the fact that our politicians have been there to support the healthcare teams, both in order to back them up and also to acknowledge the work done by everybody concerned. So during this conference, the SLRF Réanimation 2016 conference, we have the privilege, and it is indeed a great honor for us, to welcome Mrs. Marisol TOURAINE, Minister for Social Affairs, Health and the Rights of Women. And I think we can see that her presence here represents the acknowledgement, the recognition of all the work that's been done in our hospitals. And it also represents support for us in our day-to-day work. The Minister will be talking about the French health system faced with the terrorist threat.
Merci, Monsieur le Président.
Thank you very much, Mr. President of the SLRF, Professor Mira, President of the European Society of Resuscitation, President of the French Society for Emergency Medicine, President of the French Association for Anesthetics and Intensive Care, Director of the SAMU, Mr. Carly, Director General of the Health System, ladies and gentlemen. For me, it's a very important moment that I'm able to come here to meet with Professor Mira and with you, the participants, the delegates in this conference. This is just 2 months almost to the day after that Black Friday, which was such a shock to us in France. And now at the beginning of 2016, obviously, we reflect on the past year, which has indeed been a particularly difficult one for us in France, for the whole country. Difficult, too, for you as healthcare professionals. You were mobilized right from the very beginning of the year, following the terrorist attacks back in January, following which, unfortunately, there wasn't very much that you could, in fact, do. And then, of course, there were the new attacks in November. And once again, this led to a quite extraordinary, a quite exceptional mobilization of the whole of our health system. The whole of the country was holding its breath. Time seemed to have stopped in France. But in those difficult moments, you showed that you possessed extraordinary professionalism. Your work was exemplary in terms of the support that you gave to the injured. You were able to overcome difficulties, fear, and you were able to face up to these quite horrible events which struck particularly young people in France. And that's why I wanted to be here with you today. I wanted to come along here today, too, because you are representatives of the diversity of our health system. Doctors, of course, paramedical staff. I know that there are many nurses here in particular. And so it's to all of you in your various different aspects of the profession that I would like to express my gratitude, my thanks, the gratitude of the government as a whole, and I'm sure that of the French people as a whole. I also wanted to express the fact that I'm very strongly attached to the development of structured exchanges between the public authorities and the learned societies, between the public authorities and the various different national bodies and representative orders, whether they be representatives of doctors, physicians, or the paramedical professions. Also exchanges with the SRLF and the French Association for Emergency Medicine and for anesthetics and intensive care. We all need to work together. It's this that will enable us to be able to continuously evaluate the quality and safety of our health system. And it's this too which should enable us to follow almost on a day-to-day, hour-to-hour basis the situation so as to adapt, improve and reorganize so that we can always be present, able to face up to these exceptional circumstances. Because it's here that we can all judge the quite extraordinary characteristics of our health system. But alongside these extraordinary events, there are the events that take place every day, because when someone in France has to face up to difficult moments, moments that may be very difficult for the person concerned, but which are everyday events for you, it's here that we can also judge the strengths of our system. This, of course, is what we need to preserve. This is what we need to keep alive. And this is what we need to promote on an international level. Our health system is permanently on the alert. It was thus able to react immediately following these terrorist attacks. I don't need to remind you of all this. You're more familiar with this than I am. But it so happened that following the attacks in January, we already had programmed in our timetable a certain number of exercises, a certain number of reviews, and we were able to imagine that things could happen that might be worse than the attacks in January. For example, attacks in several different parts of the capital. So an exercise had in fact taken place on the very morning of those first attacks. And that, no doubt, enabled us to be even more reactive than we were previously. As soon as the alarm was raised, I activated the Health Crisis Center in the Health Ministry. The emergency services, the mobile emergency resuscitation services, the SMUR, and the mobile hospital units in connection with the emergency service of the civil health authorities were all mobilized. I don't need to pay tribute here to the excellent cooperation and coordination that existed between all these different departments, but I think it is nevertheless important to mention that. And thanks to the regulation imposed by the SAMU in Paris, the victims were sorted and sent to the various different hospital centers in Paris according to their capacities. In just a few hours, more than 40 healthcare establishments in Paris and other hospitals in the area and a certain number of medical centers of the armies were able to mobilize their teams so as to take care of all the victims and also to anticipate possible future attacks. Because obviously, before the event was over, we couldn't be sure that other attacks would not occur. The white plans were immediately implemented, and that led to the mobilization of additional staff, the operation of new operating rooms, and the availability of extra beds. And thanks to all those measures, the management of the injured was able to take place in a very effective way. In the field, your mobilization, your reactiveness were absolutely perfect, and all the victims indeed paid tribute to this. When I visited some of the hospitals the following day and the days after, and when I talked to some of the victims in hospital, all of them expressed their gratitude and mentioned the exceptional efficiency of the management of their case. Of course, they were all suffering from various degrees of shock, but they were all able to appreciate the effectiveness of the management of their cases. So several hundred victims were hospitalized, some 60 in intensive care units. 51 people today are still in hospital. 25 of them are being followed up in rehabilitation centers, and 3 are still in intensive care. And in order to guarantee the best possible management of these victims in the long term, because obviously for the victims themselves, things don't stop when they leave hospital. Things are still not over today. So in the days following the attacks, I decided to anticipate and implement some of the measures that had been planned for 2016 in our recent legislation, with, for example, free healthcare for the victims of terrorist acts. Until now, the victims of terrorist attacks had to turn first to the military social security system and could then receive free care after they had been accepted for an invalidity pension. But now, victims do not have to disburse any money at all. All they have to do is to turn to their normal social security center. We also had to, of course, manage the situations of those who had been present on the site of the attacks without necessarily being injured, but were shocked by what they had seen, experienced, and heard. So our medico-psychological emergency centers, where we find specialists in mental health, psychiatrists, psychologists, and nursing staff, all these centers were immediately set up in order to provide emergency care for victims and their families. In all, something like 300 healthcare professionals coming from all over France helped more than 5,000 people in the weeks following the terrorist attacks, either in hospital or sometimes in other dedicated centers, such as the military school or in the town halls of the 10th and 11th districts of Paris. And I want to stress here the fact that any person who feels the need of help in such circumstances should be able to obtain support. And that's true, too, for healthcare professionals. I was struck by the fact that this point was not mentioned on the day following Friday, the 13th of November, when I visited a certain number of hospitals. I went back to the hospitals in the following weeks, and then, yes, then people did talk about this problem, because a few days had gone by. And it was then that I heard a large number of testimonies, particularly coming from people who were present in the emergency rooms and who had to deal not only with the victims, but also the families of victims. And they told me that one of the most difficult things was to have to talk to the families and in the, let's say, in the heat of the moment, with all the intensity of the situation, and in a situation where it was not possible to know whether the person the families were looking for was in this hospital or not, the difficult thing was to deal with the anxiety of all these people who were looking for friends and relations. Nobody, in fact, is really prepared to deal with these situations. Nobody in France ought to have to deal with what are, in fact, wartime scenes. So all of us are still very much under the impact of these tragic events. But we also know that we need to draw the lessons from this experience in order to still further strengthen our response in terms of the health service in case of any new attacks or new events. And that's why I asked the general manager of the health system, who is present here, to work with all the players who are mobilized during these events. The aim is to get feedback concerning the way the health system reacted to these attacks. The work that has been done involves the learned societies, the French emergency services, the Army Health Service, the departments of our ministry and the various operators involved. The conclusions will be officially available next week on the 20th of January. But I wanted already to mention the fact that we have decided to make progress in at least 4 directions. First of all, I'm going to ask for a detailed analysis of the effectiveness of emergency medical interventions. That's to say, the management of cases right from the site of the attack through to the healthcare establishment where the person can be hospitalized or treated. This analysis should make it possible to identify any necessary adaptations that should be made in order to still further improve the management of these large numbers of people who are victims of projectiles or explosions in one site or several sites simultaneously. Secondly, we need to try to more rapidly identify the victims. We need to know where they are. We need to obtain the details about their family situation. This follows on from what I said earlier. You no doubt have experienced this. You've had to deal with families who are in despair, who are anxious, who are going from one hospital to another in the first hours following the attacks before they could find an answer to their questions. And everybody can understand their difficulties. The recording of the details concerning the victims, in fact, was very well done because nothing had in fact been planned for this. So it was in a more or less spontaneous way that an organization was set up. And the victims, at least those who were able to express themselves, were noted, were registered. But in view of the unusual nature of this tragedy, it's obvious that there were a certain number of problems, quite simply because nothing had been planned to deal with this type of situation. So we're now looking at the possibilities of how we can better identify people, how we can obtain data concerning them. Obviously, you need to interrogate people who come in or people who accompany them. So, along with the National Institute for Health Awareness, which is the core of the future Public Health Agency, we're looking into the various possibilities. And along with the Home Office, the Ministry for Justice and the Ministry for Foreign Affairs, we want to make rapid progress in this direction. Thirdly, we need to be able to think about the role of the medical and psychological centers. As I said, they had an essential role to play, both in terms of management of the victims, but also for handling the problems of the friends and relations of the victims. They'd done a remarkable job of work, but nevertheless, I think their structures need to be adapted to deal with events of this size. We need to look at the questions of coordination on a national level, the recordings or registration of consultations with unified forms, and also the dispatching of victims to adequate centers. It's in this way that we can guarantee continuity of management over time. The essential point, and this I know because I've talked to a certain number of victims several weeks after the attacks and after examination of the feedback that we've received, it seems that the essential point is that victims who need to obtain psychological help, they turn to these centers, calling the telephone numbers that had been made available, but they weren't able to always talk to the same people. They talked to several different people, and that meant that they had to repeat themselves, repeat the details of their cases, and that, of course, can lead to additional trauma. And some people, of course, came from outside Paris. They'd gone back to their various different homes elsewhere in France, and that means that, once again, we need to ensure continuity of care across certain geographical areas. And then the fourth point is that we need to strengthen our emergency health services everywhere in France. And we need to imagine how we might have to take care of different types of populations. It's the regional health authorities which will be looking into this. I've asked them to ensure that everywhere in France, our healthcare establishments will be capable of handling victims in the same way as occurred here in Paris. Now, I'm not calling into question the capacity of regional hospitals or teaching hospitals. insofar as their ability to treat victims is concerned. But it's not certain. In fact, it's probable that no teaching hospitals outside Paris would be capable on its own of handling such a large number of victims, the number that we had to deal with here in Paris, for example. Of course, it's obvious that Paris is probably more exposed than other cities for obvious symbolic reasons, but we cannot exclude the risk of attacks elsewhere, and indeed isolated events have already occurred. So coordination between different healthcare establishments in different regions is obviously something which is going to be important. And another key point for me is that we need to think about the specific problems linked with the management of children. And this concerns Paris too, because we know that if there were attacks which led to a large number of victims among children, we need to mobilize our pediatric services. A few weeks ago, ladies and gentlemen, I was attending a conference which was in fact part of the COP21 conference. And many foreign personalities on that occasion expressed their admiration for the way the French health system had reacted in the face of these attacks. Margaret Chan, the manager of the World Health Organization, Richard Horton, the chief editor of The Lancet, both publicly congratulated France, and they talked about you, all of you, as heroes. I wanted to repeat what they said. I wanted to pass on their congratulations, which of course concern the whole of our country, but first and foremost concern you. The excellency of our health system is something that the French people can judge every day. Here you had to face up to the worst possible situation, and the French people have once again expressed collectively their gratitude and their trust in the men and women who helped to keep them alive. You didn't only save lives, you also represented the strength of our institutions and the absolutely intangible characteristic of solidarity in our country. That is what the terrorist attacks were trying to break down, but they didn't manage to create a breach in this solidarity. But going beyond these exceptional events, I want to say that the fact that you in France and in French hospitals are capable of reacting in such an exceptional way in these exceptional circumstances, it is because on a day-to-day basis you are able to maintain an excellent health system which benefits everybody. And my presence here today among you is not intended to be simply a presence in order to follow up what is happening. It isn't intended to neglect or deny the fact that there are problems. I'm not here to deny the fact that there are difficulties due to financial constraints on our hospitals, which obliges you to undertake reorganization, which is sometimes difficult, but in which I intend to support you by launching medical projects which bring together all the healthcare professionals, both physicians and paramedical staff and others. All these difficulties I'm very well aware of, and I don't want to neglect or minimize them. But essentially, my presence here today is to enable me to express the pride that I have when I hear from abroad the congratulations that our health system receives. People often feel that it's right to criticize public services. Sometimes it seems to be fashionable to say that money spent on social services and health services is expenditure which needs to be reviewed, expenditure which is unnecessary, expenditure which creates too great a burden for our public financing in our country. But I want to say that if we are to face up to these events, such as that which occurred on the 13th of November, then we need to proclaim our faith in public service. We need to say that it is civil servants, people working for the public services, people who have committed themselves to this mission of public services, people who maintain the motto liberty, equality, fraternity of our country. It is to all those people and to the French Health Service and to the public services that I want to say thank you. Thank you to all of you. Thank you to all the French healthcare professionals who are here to keep alive those values, which are also the values of the Republic. Thank you all for your attention.